Hello, everyone, and welcome back to Neuroalchemy, a NeuroSynergy podcast where we explore the meeting place of science, soul, and the art of becoming. I'm your host, Dr. Sarah Young. Here on Neuroalchemy, we slow conversations down on purpose. We define terms clearly. We name complexity without overwhelming, and we approach healing as a multidimensional nonlinear process that honors both the brain and the lived human experience. Because clarity creates safety, and safety opens the door to deeper insight, choice, and healing. Today's conversation centers on psychology, responsibility, choice, and change. Some of what we explore may challenge familiar narratives about blame, validation, or what healing is supposed to look like. You're invited to listen gently, pause when you need to. Nothing here is about force or perfection. Feel free to take a deep breath. You don't need to decide anything today. Today, I'm joined by Dr. Larry Waldman, and I'm genuinely looking forward to this conversation. Dr. Waldman is a psychologist, author, and educator whose work focuses on personal responsibility, emotional regulation, and reclaiming agency through conscious choice. His approach is firmly grounded in psychological science while also challenging cultural narratives that often keep people stuck in blame, avoidance, or externalized control. This conversation is not about perfection. It's not about positivity. It's how change actually happens, how responsibility differs from shame, and how psychological frameworks can either expand or quietly limit human potential. Larry, thank you for being here and welcome to Neuroalchemy.
Well, thank you. I appreciate the opportunity.
Before we move into our content for today, I'd love to begin by helping us arrive. So, how are you arriving today, Dr. Waldman?
Arriving well. I taught a yoga class this morning, which went very nicely, and had a light breakfast, and I'm ready to go.
I love that. Thank you for sharing that. For all of our listeners out there, remember there's no right way to arrive here. However, you're showing up today is enough. Before we go deeper, I want to orient our listeners here on Neuroalchemy. We define terms as if you're hearing them for the very first time. Not because you're uninformed, but because language shapes perception and perception shapes experience. Psychology is a science, but many people were never taught what kind of science it is or how different psychological frameworks shape the way professionals think, assess, and intervene. So, Larry, to begin, I'd love your help clarifying a few foundational ideas. When we say psychology is a science, what does that mean in practical terms for research, theory, and clinical application?
Well, it certainly is a science in every sense of the term. There are rules, if you will. There are paradigms. There are ways to research what's happening and so forth. It might not be quite as clear as atomic research or whatever, or something like that. But it's clearly a science which has different facets. So for example, when you see, let's say, a therapist for one reason or another, and this therapist is well trained, he or she should look at the client and make a determination as to what type of treatment is appropriate. There's plenty of research in those arenas that will tell you, yes, this is appropriate for this kind of thing, and this is appropriate for that, and so on. And so we're hopefully you're not seeing a therapist who is a one-trick pony, if you will, but rather is familiar and skilled with all the various therapies.
How does psychological science differ from what many people are seeing today in terms of coaching, self help, or philosophical approaches to behavior and change?
Well, I'm not so sure they're different. There's a lot of similarities from my perspective, and it's something that I would always teach my young graduate students when I did adjunct instruction. I always made sure that they these students had this proper perspective, and that is there are really four schools of thought, if you will, and each school looks at pathology, if you will, or problems in a different way, and of course, they look at treatment a different way. Now, it's not to say that any one of those is better or worse than another one. It's what's appropriate for the client at that time. Now, if you like, I can go further and explain them, but I'll leave that up to you.
Yeah, I mean, it is important, I think, for everyone to understand that psychology isn't just one single viewpoint where everything comes from, but it is a field made up of those multiple schools of thought. Would you like to share more about what those multiple schools of thought looks like?
Sure, be glad to. And we can take them kind of chronologically. The first school, if you will, is often referred to as the biological school. And this largely is in the realm of the psychiatrist to a large degree. And the thinking here is that, you know, the problem the client has or the patient has to do with their biology, their brain chemistry, if you will. And thus, the treatment is to rectify that problem. And of course, that therefore pharmacology is the treatment of choice. And over my almost 50 years in practice, there have been many times when I was very pleased to have two psychiatrists in my office that I could refer patients to so that they could benefit from a medical or a biological intervention along with another one as well. And that of course was the earliest view, if you will. The next view that came along is the psychoanalytic view or analytic view. This is the one that was promoted by Freud primarily in the late 1800s. And this view basically says that, you know, what the child learned during those early formative years is critical. For example, let's say a child was raised in a broken home. One or both of the parents were alcoholics. There were daily fights. Things would get thrown sometimes, pots and pans or whatever. And of course, the child is, as I like to say, naked and naive. They don't know what's right or wrong, good or bad, normal or abnormal. And so to the child, this situation, at least early on for the first, well, close to decade of their life, they assume is what is happening for everybody. So if you grow up in this kind of environment, you can quickly see that someone could become very anxious, where they've come to learn that at any minute, at any time, something crazy could happen about which they had no control. So if you grow up under those circumstances, and that it makes sense that their thinking isn't wrong, they're not crazy. Anyone growing up under those circumstances would believe the same thing. So the kind of treatment, if you think this is appropriate, is to get the client to come to recognize why they believe the way they do. Not saying their belief is wrong, but why they believe the way they do now, and that it's possible to learn to believe something else. The whole world isn't that way, and so on. Typical example that I might that I ran across many times is a female client, says, comes into me and I just broke up with my boyfriend. This happens to me all the time. Why do I keep selecting, these kinds of men? Well, immediately that to me triggers, we want to look at things analytically because dollars to donuts, so to speak, there are issues that she has with her father or lack of father, perhaps. And so that's where that comes from. There are two more contemporary views that came about in the early 1800s. One is the cognitive view. The cognitive view, and when I say it's contemporary, is that they focus pretty much on the present rather than so much of the past as the biological and of course the analytic views do. The cognitive view basically believes that what we say to ourselves determines how we feel and how we behave. And if you think about it, because you see it often, there are a lot of people walking around with what I refer to is a bad case of stinking thinking, where they are saying negative things to themselves all the time. And so someone who is fearful, anxious and so on, afraid to take a chance, take a risk, and so on, is worried about what other people might think about them, etc., is most likely doing a number on themselves by thinking in a very negative, self-negative kind of way. And if that appears to be the appropriate approach for that patient, well, obviously, then what needs to be done is to help that person recognize again what they're doing to themselves, what they're saying to themselves. Many times, particularly during the first session, I'll make little chit marks or little marks on my notes every time the patient makes a negative comment about themselves. And sometimes by the near the end of the hour, I've got 15, 20, negative comments and I'll feed some of them back to that person and say, look, if you are telling yourself that you're not going to succeed, that you never win, et cetera, how then can you proceed in a positive way? It's going to be difficult. And then finally, the most recent one, again, a contemporary view, is referred to as the behavioral perspective, the behavioral view. This is the view where the consequences of your behaviors determine who you are. So that when you behave, when you do something, you receive a consequence more often than not. It could be a positive one, it could be a negative one, or it could be a neutral one, or no consequence at all. And based on what is going on over your life, that shapes you. Now, what happens for a lot of people is that they do things that might make them feel good at the moment, but have negative consequences, like drug use, for instance. It feels good for the moment, but obviously the consequence of that is a negative one. Or interestingly, I use this a lot with parenting. If you ask parents what's the most valuable thing you could give to your children, you hear them saying, well, love and respect and discipline and things like that. And all of that's true. But what all that really looks like to the child is attention. So that, making a longer story short, the most valuable thing a parent can provide to their child is attention, individual attention. And so the $64 question then is, when do most parents provide their attention to their kid? And if you study this, what you find is, and the research is very clear, that about 90% of the time when the child is misbehaving, the parent is attending to them, and only about 20% of the time when the child is behaving appropriately is the parent attending to them. So again, the consequences of that child's behavior, you see, is basically teaching him or her that it pays off to be bad, pays off to misbehave, and so on. And so what a therapist in this mode does is, again, I keep talking about understanding, getting the client to understand what are the consequences of the behavior and change them. So that's a very brief outline of these four different views, but I think you can see this is a significant part of what the science of psychology is about.
Thank you so much for breaking that down for us. I think a lot of people don't always realize that the therapist, the coach, the clinician that they're working with might be operating from a very specific, psychological lens that might be different than another. Professional. A major theme in your work is responsibility, and that word can be triggering for some people. How do you differentiate personal responsibility from blame or shame? And what does healthy responsibility look like?
Well, again, depending on what framework you want to use, I would look at how was that child taught to be responsible. By responsible, I mean making good, healthy choices. Now, again, if you have a parent who's indulgent with the child and expects very little, well, I think you can begin to see what's likely to happen as they mature. If the parent was kind of a drill sergeant, if you will, and very negative about doing things they're supposed to do, it's possible the child could rebel against that. Again, a lot of it depends on where did this come from. Hopefully, what happens is that the child was raised in an environment where they were first clearly instructed about what it is they were supposed to do, because sometimes we're not clear about that. And once the child does it, they were rewarded or reinforced for it. So the child comes to understand that, yes, it pays off to have a clean room or to make your bed or to do your homework on time, et cetera, et cetera. Whereas unfortunately, some kids never get that. And we see that later on in life. Responsibility is lacking.
You emphasize choice as a core mechanism for change. From a psychological and neurological perspective, how does choice function in the brain?
That's probably above my pay grade, I guess. I can't really respond to that. I'm not working within the brain, if you will.
That's okay. What do you think gets in the way of people believing that they have real choice?
Well, that's a different, that's, well, again, and thank you for that question. There certainly it comes back to what we've been when talking about children growing up have, hopefully come to learn that they do have options. Now, I've seen parents talk to 3-year-olds and say, okay, would you rather do this, or this? Well, for a 3-year-old, no, they're not ready for that. So early on, I think it makes the most sense for parents to pretty much direct the child. However, as they approach, pre-adolescence and certainly adolescence and so forth, the time comes where, yes, they should be given options. Frankly, even the option to fail sometimes, and then allow what we call the natural consequences to occur. I never made my kids do their homework and so on. But if the if one of my sons neglected to do their homework, I would say something like, that was a poor choice. And I've sent an email to your teacher indicating that you chose to blow off your homework, and she can apply any consequence that she thinks is appropriate.
We live in a culture that often confuses validation with permanence. How can you help people feel seen and validated without reinforcing a stuck identity?
You broke up at near the end. Could you give me that question again, please?
Absolutely. So how do you help people feel seen and validated without reinforcing a stuck identity?
Well, again, it goes back to being willing to take a chance to put themselves out there. One of my books talks a lot about that, which it's entitled "Too Busy Earning a Living to Make Your Fortune." And the key point there in that book is so many people are stuck in jobs they don't like. They hate going to work. They don't like what they're doing, and so on. They don't feel fulfilled, and so on. But they're stuck. They're scared. They don't know what the alternative is, and so on. And I get it. I mean, yes, it is a scary proposition. But if you don't make a move, then you're going to spend an entire career doing something, career calling it that, I guess, doing something you don't care for or unhappy with. And that's
Nothing changes if nothing changes, right?
exactly. You're right. That's right. Change is good. And of course it's risky. It always is. Making a new choice can be a scary thing, but that's what makes us grow. We grow from that. And feeling confident in ourselves that we can make an effort. Now, that doesn't mean that every effort is going to be successful. No. As I say in my book, making an effort and failing is not a terrible thing. One, you may have learned something that doesn't work. And two, at least you tried. I recall Michael Jordan's, if you remember him, the famous basketball player with the Chicago Bulls, once said, "I missed every shot I never took." And that's what happens. If you don't take a shot, then we know for sure you're going to fail.
What role does discomfort play in growth?
I think it does a lot. I mean, if we could live a life where all the growth occurred with good consequences, that would be wonderful, but that's not real. In fact, I firmly believe we learn more from our mistakes than we do our successes. So
Absolutely. I couldn't.
and so, yes, but at least we're trying, and so on. Uh, and so it's important that we keep making those efforts. My wife and I have often talk about this, because I do various things and so on, and I call it throwing mud against the wall, hoping that something sticks. Okay. And my wife teases me, "Well, yes, fortunately, many things have stuck, but there's Mount Kilimanjaro at the bottom of the wall here." And that's true, but it shows how much I've tried and how much I've learned from things that didn't work. But if you keep trying and you keep learning, then you're likely to become successful.
You've been in this field a long time. Where do you see people unintentionally sabotaging their own healing, even when they're highly motivated?
Well, sometimes they don't get the right direction, if you will. One good thing in the States, it at least brought it out that it's okay to seek counseling. There still is, though, that stigma about getting help. And trying to do some of these things on your own is difficult, and that's why it's there. I mean, as I've said often, if you're driving down the street and your transmission and your vehicle starts making a really terrible sound, you go somewhere and you fix it. Well, if you're having problems with your kids or your marriage or your own thoughts or your job or whatever, why not fix it? Try to fix it. Seek a specialist, just like you seek a transmission specialist, you seek a mental health therapist.
Many of our listeners explore integrative, somatic, and nervous system based approaches. How do you see responsibility, cognition, and choice integrating with body based or trauma informed work rather than opposing it?
I'm sorry, you broke up once again. Could you repeat that, please?
Of course. So many of our listeners explore integrative, somatic, and nervous system based approaches. The question was, how do you see responsibility, cognition, and choice integrating with body based or trauma informed work?
Well, I think there is a connection there. Yes, I mean, I think it's clear, it should be clear that while I noted these four different perspectives, it doesn't mean that they can't interact and interrelate. And certainly they do. So obviously when we're doing things the right way, behaving, thinking, feeling, and so on, it's going to integrate well with our biological processes. And of course, vice versa. When some of those things are not moving in the right direction, we feel it in an organic manner as well.
We like to end each episode with a gentle invitation for our listeners, something practical that our listeners can explore without pressure or perfection. Dr. Larry, if you were to offer something, a small grounded practice for the upcoming week, what would you suggest?
There's an old behavioral saying that I frankly live with and teach, and it goes like this: It is far easier to behave your way into a new feeling than to feel your way into a new behavior. And what that means is there are so many people who aren't doing what they need to be doing because they don't feel like it. And often they're unsuccessful. Rather, go ahead and do it and then feel the success of having done it. And that is far more beneficial.
I think that may be my favorite. Thank you so much for sharing that. And before we close, what do you most hope listeners walk away understanding about themselves, their psychology, or their capacity for change?
Well, I hope they realize that psychology is a science and that people who provide treatment and so on are semi-scientists as well. And that there are differing views, and hopefully they'll find someone who can apply the right view for their treatment. May I mention some of the books I have that yeah, I've written 8 books, and I'll just list them. In fact, kind of referred to some of them already here. Who's Raising Whom was my first one. Coping with Your Adolescent. How Come I Love Him But Can't Live with Him, my marriage book. I did mention previously Too Busy Earning a Living to Earn Your Fortune, Overcoming Your Negotiophobia, Love Your Child More Than You Hate Your Ex. And my latest one is Silver Sex, Insights into Senior Sexuality. And by the way, I do a lot of professional speaking to the community and also uh, other associations that I'm always open to.
Thank you so much for that. And for everyone, Larry will be sending me his links, and those will be available in the show notes for anything that Larry would like to direct you to. That will be available. Larry, thank you for this thoughtful, grounded conversation and for bringing clarity to topics that are often oversimplified or misunderstood. Before we close, I want to name this: I never leave these conversations unchanged. There's always something I'm taking with me, something I'll reflect on, and something I'll continue to integrate long after the recording is through. And if this episode resonated with you, please consider liking, subscribing, and sharing it. That's how these conversations travel, and that's how they reach the people who need to hear them the most. To our listeners, thank you for spending this time with us together today. If today's episode stirred something, let it be an invitation instead of a demand. Healing doesn't happen through force, it happens through awareness, choice, and small moments of honesty. This is NeuroAlchemy, a NeuroSynergy podcast. I'm Dr. Sarah Young. Until next time, keep listening inward, honoring your capacity, and becoming who you're meant to be. Bye for now.